and away from COVID-19. So let's take a moment to pray for our country best to fight against this virus. My name is Fairuz Umairah Binti Ridwan. So before I start my presentation, have you guys ever think on how blind people pay at the counter when they buy something? On how they want to know how much they have the money? So with me, I have 50 ringgit and 10 ringgit and 10 ringgit notes. Okay, for 50 ringgit, they have the diamond shape. Okay, you guys can feel the diamond shape. So blind people usually use their sense of touch to feel and to know how much they have. So for 10 ringgit, they have the line, 2 line. Okay, you guys can check your money. Like for 1 ringgit, they have 1 line, also 5 ringgit. So okay, that's just a hint about what we are going to present. So our group will be present about blind and visual impairment. So first, what is blind and visual impairment? So blind and visual impairment is any disability or issue that interfere the vision, include partial sight and also blindness. Therefore, visual impairment can be classified into 7 classes. The first one is visual impairment. Visual impairment is the loss of acuity and inability of a person to see the object clearly as what normal people eye can see. Okay, so it's also can be defined as an overall term of total blindness and also partial sight. The next one is partial sight. Partial sight is where one visual capability is limited. Because it occurs due to trauma or disease, and it also can be corrected by using eyeglasses. You know, they can, for partial sight type of classification is they can read but with a large size of font, and by using the aid like glasses or magnification. Next is legal blindness. Legal blindness also can be defined as visual acuity. So legal blindness is the acuity of 20/200 or less in a better eyes with best possible correction or a field of 20 degree or less diameter in the eyes. Next is blind. Blind is person that cannot see anything because of injury, disease, and also congenital condition. So what is congenital condition? Congenital condition is a medical condition that occur at or before birth, or also can be referred as birth defect. Okay. Next one is travel vision. Travel vision is the person able to see 1.5 until 3 meter away from them, compared to normal people, which they can see 60 meter away from them. So blind people can only see what is nearer to them only. They cannot see what's far away from them. Okay. Next one is light perception. Light perception is the person can able to recognize a light, but they cannot detect what movement the person that in front of them are doing. You know, they can see light, but they cannot see if they in front of someone, even just 1 meter away. They can see a light entering their eye, but they cannot detect what the person in front of them are doing. Okay, they can only see a shadow. Okay. Next is total blindness. Total blindness means there is no visual acuity, and also because they just don't see anything, they unable to recognize any light that enter their eyes. They cannot see, they cannot detect what we are doing in front of them. So they just cannot see anything. So next, I will tell about the structure of the eye. Structure of the eye, the first one is sclera. Sclera, the function is to protect the eyeball, the outer layer. Then the pupil is an opening through which light can enter the eyes. Okay. Next one is iris. Iris is control how much light enter the eye by changing the size of pupil. Then cornea. Cornea usually cover the iris and the pupil. So we have lens. Lens act like a camera lens by focusing light onto the retina. And then retina is to detect light and turn it into electrical impulse, which then the impulse, the optic nerve carries the impulse, carries the impulse for sight to the brain. Okay. Next one is choroid. Choroid is to provide nourishment to the outer layer of retina through the blood vessel. Then aqueous humor is the function is to maintain intracellular pressure in the eye. And then the last one is suspensory ligament. This is the function is to adjust the thickness and the curvature of the lens. Okay.
Okay, I'm Muhammad Nur Naim. We'll continue with types of blind. Okay, actually types of blind is visual impairment classification that have been created by IPSA or IBSA for Paralympic athletes. Okay, for the first classification, which is B1, the person must have a very low visual acuity and also no light perception. The person needs have to inability to recognize the shape of hand at any distance or in any direction. Next, B2 have a higher visual acuity, which is 20/60, visual field of less than 5 degree radius. The person have the ability to recognize shape of hand, and the visual acuity is of 2600, and usually the visual field is less than 5 degrees. And the last one, which is B3, have the highest visual acuity, 2060 to 2200. Visual field usually from 5 degree to 20 degree radius. Okay, next slide. Which is the causes for visual impairment, which is before birth. We have albinism, retinoblastoma, and also retinopathy of prematurity. I will explain in detail later. Next, after birth, we have cataract, glaucoma, macular degeneration, retinitis pigmentosa, diabetic retinopathy, and cortical visual impairment. Okay, for the first one, albinism. As you can see in the slide, it is a genetic disorder causes the skin, hair, or eyes to have no or little color, lack of color or pigment of iris and retina, and undeveloped fovea. For albinism, usually we can see people who is albinism. You have white hair, white skin, and their eyes also white. So if a person is affected with albinism, diagnosis with albinism, it is associated with a number of vision defects. For the first one, which is photophobia, the person will experience of discomfort or pain to the eyes due to the light experience. So basically, if the person see light exposed to their eye, they will feel discomfort and pain at their eyes. Next vision defects is nystagmus, reduced or limited vision. Due to the involuntary movement of the eye, it has been called dancing eyes, which is the eyes move involuntary without we move it. Next is amblyopia, called lazy eye. Disorder of sight in which the brain fails to process inputs from one eye and over time favors the other eye, results in decreased vision in eye. So basically, if a person is albinism, the eye will be wide. It is not nice because it is actually have a disadvantage, which is their vision will be decreased. Next is retinoblastoma. For retinoblastoma, it is actually cancer. An eye cancer occur in the retina. Retinoblasts growth out of control, affect the children due to inherited, also can affect adults. Though most children survive this cancer, they may lose their vision in the affected eyes or need to have the eye removed. Retinoblastoma usually occur when the cell cancer happen in the retina, so it will affect the retina and it will affect the vision. The sign and symptom for retinoblastoma is red and irritated eyes. Most common and obvious sign that we can see is abnormal appearance of the retina as viewed through the pupil. Okay, next slide, which is retinopathy of prematurity. It is actually an abnormal growth of blood vessel at the retina. Occur at premature babies less than 31 weeks. Can disappear as infant grows and not disappear need to be treated. So, if the baby is happen to have the retinopathy of prematurity, it is actually can lead to blindness. These vessels, which is the abnormal growth of blood vessel, tend to leak or bleed, which is leading to scarring of the retina. When the scar of the retina shrink, they pull on the retina. They pull the retina onwards and detaching it from the back of the eye. Because the retina is a vital point of vision, its detachment will cause blindness. So basically, as you can see in the slide, the picture, when the blood vessel is leak or bleeding, it will lead to scar, and when the scar is shrink, it will pull the retina forward and detach it from the back of the eye, and it will lead to blindness. Next slide, which is before it, this is the view for a baby who has a retinopathy of prematurity. Next slide, which is cataract. Cataract is causes after birth. Cataract is a clouding of eye's natural lens, which lies behind iris and pupil. Lens unable to produce sharp image due to clumps of protein, usually occur at elderly person more than 40 years old. In the picture, you can see normal eyes, normal lens, eye with cataract, the clouded lens. So for cataract, it also lead to decrease in vision and blindness. The symptoms may include faded colors, blurry or double vision, trouble with bright lights, and trouble seeing at night. So it will result in trouble driving, reading or recognizing faces. Cataract may also occur due to trauma or radiation exposure. So we need to take care of our eyes, such as wearing sunglasses during daylight, because it will give us cataract. Next slide. Glaucoma. Glaucoma is a damage of the eye's optic nerve caused by too much pressure in the eye, occur when too much fluid build up at the chamber. As you can see in the picture, development of glaucoma. The pressure inside our eye will damage our eye's optic nerve. Glaucoma also can lead to blindness for people over age 60 years old. More common in adults, of course, because it is a causes after birth. Many forms of glaucoma have no warning signs. You may not notice a change in vision until the condition is at an advanced stage. Okay, glaucoma actually have two types, which is the first one is open angle glaucoma, and the second is acute angle closure glaucoma. So for the symptom for the first type which is open angle glaucoma, you will feel patchy blind. You will see patchy blind spots in your side or central vision, frequently in both eyes, and tunnel vision in the advanced stage. Symptom for acute angle closure glaucoma: you will feel severe headache, eye pain, nausea and vomiting, blurred vision, and also eye redness. Your eye will be red, like in the picture in the slide. So the causes for open angle glaucoma: your eyes drainage system. Our eyes drainage system becomes inefficient over time, leads to increased amount of fluid in our eyes, and pressure will increase in the eye. So when the pressure in our eyes increase, it will lead to glaucoma. It will damage our optic nerve. And causes for acute angle closure glaucoma: it occurs when the drainage angle in the eye becomes blocked. Drainage angle will be very narrow. As the angle narrows, the fluid in the eye is blocked from the drainage system and pressure increase. So basically, open angle, the eye's drainage system is failed. The acute angle closure, the second type, the drainage system angle is narrow, so the fluid in our eyes blocked. So basically both will damage our optic nerve and will cause glaucoma. Okay, for macular degeneration, it is damaged part of retina called as macula. Affects the side of central vision, divided into two, which is wet and dry. Usually occur at person at the age of over 60 years old. So as you can see in the slide, the first picture, which is the dry macular degeneration without bleeding. In the middle, normal healthy macula, and the right one, wet macular degeneration with bleeding. And the other picture is the vision of a person who has macular degeneration. So basically, macular degeneration will leading cause of severe permanent vision loss in people over age 60, and it happens when the small central portion of your retina called the macula wears down. And because this disease happens as you get older, it's often called age-related macular degeneration, which is AMD, and doesn't cause blindness but might cause severe vision problems. So basically, macular degeneration will not lead to blindness but severe vision problems. As you can see in the slide, the vision will actually be like that. So there are two types, which is wet and dry form. You may have yellow deposits called drusen, DRUSEN, in the macula. A few small drusen may not cause changes in your vision, but as they get bigger and more numerous, they might dim or distort your vision, especially when you read. As the condition gets worse, the light-sensitive cells in our macula get thinner and eventually die, and we may have blind spots in the center of our vision. As that gets worse, we might lose central vision. As you can see in the slide, the picture, our central vision is blurred or have a blind spot. Okay, for wet form, blood vessels grow from underneath our macula. These blood vessels leak blood and fluid into our retina. Our vision is distorted so that straight lines look wavy, and may also have blind spots and loss of central vision. So if you see in the slide, the dry one, you will see a yellow deposit or yellow spot, which is called drusen, and the wet one you see a blood, because blood vessels growth underneath our macula. So in the circle one, in the wet, it is blood. So both will not lead to blindness, but will cause severe vision problems. The vision of a person with macular degeneration is their central vision will be blurred or blind spot. Next slide. Retinitis pigmentosa inherited disorders involve degeneration of cells in retina, common in night blindness and peripheral vision, damage of rods and cones. So as you can see in the picture, normal retina and retina affected by retinitis pigmentosa. So basically what we can see is retinitis pigmentosa is our cell in the retina is damaged or breakdown or loss. So retinitis pigmentosa is a group of rare genetic disorders that involve a breakdown and loss of cells in the retina, which is the light sensitive tissue that lines the back of the eye. The cells name that is affected, that loss, is called photoreceptors. The photoreceptors is damaged. The photoreceptors is actually cells in the retina that begin the process of seeing. So without the cell, we cannot see properly. In the slide, you can see the vision of a person who has retinitis pigmentosa. So early symptom for a person who has retinitis pigmentosa is decreased night vision, loss of peripheral vision, which is sight vision, and late symptom is vision loss or blindness. So we can see that retinitis pigmentosa will lead to blindness, not like macular degeneration. Okay, next slide. Diabetic retinopathy. Okay, we move to diabetic retinopathy. It is a damage of blood vessels in the retina caused when the blood vessels leak or swell due to high blood sugar level. So as we can see, diabetic retinopathy is usually occur to the person who has diabetes. In the picture, in the slide, the left one is the vision of a person who has diabetic retinopathy, and the figure is normal eye, and also the comparison between normal eye and also diabetic retinopathy. The blood vessel is leak, become swell. So diabetic retinopathy is a diabetic complication that affects eyes. It also leads to blindness, and the condition can develop in anyone who has type 1 or type 2 diabetes. The symptom is spot or dark strings floating in your vision, blurred vision, impact colored vision, dark or empty areas in your vision, or vision loss, which is mean dark or empty areas in your vision is like in the slide in the figure. So the causes is too much sugar in blood can lead to the blockage of the tiny blood vessels that nourish the retina. As a result, the eye attempts to grow new blood vessels, but these new blood vessels don't develop properly and can leak easily, can lead to glaucoma. So it is basically diabetic retinopathy will lead to glaucoma because the blockage of the tiny vessels will lead to growth of the new abnormal growth blood vessels and will lead to pressure in our eye and lead to glaucoma. And the last one, which is cortical visual impairment, damage to visual system between posterior visual pathways and occipital lobes due to lack of oxygen, blood supply and hydrocephalus, unable to precise distance, depth and interpreting draws. So what we can say about cortical visual impairment is it is a form of visual impairment that is caused by a brain problem rather than eye problem. So a person who has a cortical visual impairment, usually the problem is with the brain, not with the eyes. The problem in the brain lead to the eyes actually. So the major causes are lack of sufficient oxygen in the body's blood cell, and also ischemia, which is not enough blood supply to the brain. And it may occur during birth process, head injury, and also a stroke involving the occipital lobe. And the most common symptom for cortical visual impairment is abnormal light response, which is the photophobia, and also poor visual acuity. That's all. I will move to the next slide. I will pass to my friend.
So next is visual acuity. Visual acuity commonly refer to the clarity or clearness of our vision. Usually it used to determine the smallest letter that you can read on the chart. So if you guys go to the eyes test, usually the doctor or the medical assistant ask you guys to stand 20 feet away from the chart. Usually they put the chart on the wall, so you guys need to have to stand 20 feet away and read from the largest size of alphabet until which size of the alphabet you can read. Okay, so it also can visual acuity also can known as 20/20 vision. So if you have 20/20 vision, it means that you can see the alphabet clearly at 20 feet, but it only indicate the sharpness of or clarity of vision at a distance only. Next, we'll go to the treatment. The first treatment, you can wear glasses like me. I'm wearing glasses to treat my eye. Okay, you guys can go to the optic clinic or optic shop. They have the machine to test your eyes whether you need to wear glasses or not. And then you have to go through to the visual acuity test to make sure they give you the correct lens for your glasses. Okay. The next one is control diabetes. So you need to control your diabetes. If you have diabetes, you need to control because it can make your vision blurred if you have too high of blood glucose level. Okay, the next one is contact lens. So usually contact lens, mostly people buy that have a daily contact lens or bi-weekly and also monthly contact lens. So if you want to buy these three, you need to have a prescription from the doctors. Do not usually buy from the online because it have fake contact lens can make your eyes become worse. Okay, you need to don't wear just because you want a colored eyes. Okay, it will make your eyes become worse. Next one, if you have an eye infection, you can use eye drop to treat the infection. Okay. The next one is surgery. The most popular one is the LASIK surgery to correct our eyes. So I have the video on how the LASIK surgery being conducted. So let's watch it first.
In LASIK surgery, there are two main stages. In the first stage, we created a flap in the cornea. This can be done through a laser or through a mechanical microkeratome. The second phase is where we lift the flap, we apply a second laser to the bed, and we do our shape change. We then return the flap, and that completes the surgery process.
Then prevention. So how to prevent from our eyes become visual impaired or blind. So do not watch television, computer or a phone closely to your eyes. So you need to have a distance like 20 feet away. Okay. So and do not read in the dark. Do not play your phone in the dark. Then you guys can do regular eye exam or eye test at the optic clinic or any other clinic. Okay, and then you guys can wear sunglasses to protect your eye from UV. Then you guys can eat healthy food like carrot, which help the function of the eye. Okay, you guys need to eat healthy food.
Okay, I will continue with safety, health and medical consideration. For the first point, which is do not wear contact lens in prolonged times. This is especially for the fake one because we should not wear fake contact lens because it will harm our eyes. Even we wear the real contact lens, the real one, the contact lens should have their own duration time to wear. I mean the contact lens should have their own prescription, so we need to follow the prescription on how long we should wear. Next is always use the cane while do any activity. Why we need to use cane? Because we need to use the cane to guide us to do any activity such as walking. Next point, which is often blinking your eyes when using electronic devices. Blinking is one of the technique to cleanse our eyes from the dust. Next point, which is keep hygiene and use the suitable substances, such as in Malaysia we have IMO. So use IMO to cleanse our eyes from the dust and make our eyes healthy.
Okay, next we go to our next slide, which is method of coaching. Okay, first, familiar with the equipment and instruction used. Okay, for example, tennis ball, which is small size, right? So the athlete will just imagine we hold the tennis ball like this, right? So this is for the small ball, which is the equipment that I say before. So and size ball of football we hold like this, right? So the keeper of football also hold the ball like this. So there is the difference between small size of ball and big size of ball. So the athlete will recognize the equipment, not only ball. Okay. For the next point is verbal and clear explanation, which is athlete must use the good word to clear properly to the athlete. So use verbal and clear word. Okay, next point is enhance directional awareness. For example, the coach tell to the athlete, for example, 3 step front to drain. So the athlete will take the step carefully to avoid from falling to the drain. So another example, 2 step to the center line. This is for sport, okay. And last point is postural corrective. For example, in squat exercise, you need to chest up and lock back. Maybe this blind athlete never experienced how to chest up and lock back. So the coach must must touch the body, the chest, the back, how to do the chest up and lock back. Okay. Next slide is what is Braille? Braille is a system of printing, writing, or reading used for blind population. So this Braille is invented by Louis Braille, as we can see at the slide of the cartoon picture, which is closely like Louis Braille. He is a French educator, developer, and also inventor of this system, and born in 4 January in 1809. He died at 6 of January in 1852. His system remains virtually untouched until now. Okay, next I will teach you Braille alphabet. Okay, as you can see, this circle stand for 1, this 2, 3, 4, 5, and 6. So how the for example, we take B. So B is 1 and 2. So if you can't remember how the position of the black dot, so you just recognize the number of the alphabet. For example, B is 1, 2.